Hi, good morning, everyone. I'm Dr. Bay, Family Medicine Specialist from University Malaya, Malaysia. Today, I would like to share my research on investigating predictors for poorer outcome post-deferment among patients with hypertension during COVID-19 pandemic at primary care clinic in a teaching hospital, Malaysia. As we all know, back in 2020, a worldwide movement control order was implemented, including in Malaysia. University Malaya Medical Center was one of the hospital gazetted to treat those patients, where routine appointments for all outpatient and specialty clinics were postponed and rescheduled to minimize cross-infection. However, little is known of the impact of such measure. The objective of our study is to investigate the outcome of a cohort of patients with hypertension affected by a 6-month appointment deferment, as well as to identify the association between basic socio-demographic data and clinical parameters and comorbidities with poorer outcome post-deferment of COVID-19 pandemic. This was a retrospective cohort study where we included patients for whom appointment rescheduling were made. We excluded those patients who were not able to be contacted, those patients with incomplete documentation, and as well as the patients who did not have a follow-up visit post-deferment. These are the definition of the data that we recruited for our data analysis. We have a total of about almost 600 patients, and we excluded those without hypertension and those without post-deferment diastolic blood pressure readings. And we have a total of 419 patients entered into our final sub-analysis. Our mean age of our patients were 68.2 years old. Gender, ethnicity, comorbidities, and duration of deferment is shown in Table 1. For the clinical parameters shown in Table 2, mean systolic pressure for pre-deferment was 143 mm mercury and post-deferment was 145 mm mercury. For mean diastolic blood pressure was 76.7 and 76.6 respectively. We reported the other clinical parameters in median and interquartile range as they are not normally distributed. Dependent variables or outcomes for our study is defined as unscheduled visit, hospitalization, admission to emergency department, disease, which contributed of 16% of patients had poorer outcome post-deferment. We also did multivariate analysis which shows that those patients with existing ischemic heart disease have a 2 times increased risk of having a poorer outcome post-deferment after COVID-19 pandemic, with a p-value of 0.04, which is significant. Many studies have raised the concern of negative impact to patients, including delay in the diagnosis or treatment. This finding was similar to our study as well. This could be resulted from limited access to healthcare, or could be driven by interruptions of the medication supply or inadequacy of self-management practices. We concluded that the appointment deferment practice need to be done in a primary care setting with a careful patient selection, especially on the patients who have had underlying ischemic heart disease. Additionally, the development of comprehensive guidelines and standardized protocols is crucial to a better preparation for future pandemics. These are my references. And with that, thank you very much.